Okay, so today we have a very special guest. We have Robbie from AART. And you have something fun that you want to share with us today. This is a butt implant.
Yes. This is great. I've got such an audience here today. I represent an implant, a soft solid implant manufacturer by the name of AART, Aesthetic and Reconstructive Technologies. And we've got a featured product that Dr. Nguyen's office is very excited about. And just wanted to tell everybody a little bit about this today and to satisfy their curiosities. So what questions do you guys have before
Well, let's see the implant first of all. So this is what it feels like. It's nice. So I know a lot of our patients have been asking us, about the butt implants, and a lot of doctors were scared about it, and Dr. Nguyen was one of those that the older implants had a lot of complications, right? Why was that? Why were people having too many problems with the
and then especially in the past 5 years, implants have come a long way in regards to Buttock implants and other body implants because of the softness. The progressive implants are softer now and they're more flexible and pliable. And we have a nice texture on these implants, as you can see, because it's smooth, but yet it's textured.
I noticed that it has like nooks and crannies.
This is actually a custom texture for any other company, but this is our traditional implant texture. And what it does is it inhibits capsular contracture, and it allows for easy manipulation in regards to the surgeon placing the implant because of the softness. And he's able to make a smaller incision, which has also come a long ways, and that we can make a half the size incision than we used to with this procedure.
Now, with the old incision being bigger, was that part of the problem that was making some of those complications? Because that was one of the things that people were really interested about, was the smaller incision.
Yeah, it could. It is in a high tension area, so basically anytime that you can make a smaller incision, there's less to worry about. Although we stress not to use large implants anymore, also in addressing your question, the smaller the implant, we've had a lot better feedback on patient satisfaction and infection. It just doesn't really seem to exist. It's about the same infection rate as breast nowadays.
So where is the incision?
And that is in between the buttocks. Normally they'll make one incision in between the buttocks, and otherwise known as the crack of your butt. And also I have seen a few doctors make 2 incisions, but it's basically in between the buttocks.
Like on the tailbone, or?
It's more towards the upper part of the buttock.
Okay.
Exactly.
And you saw the videos that we were doing with the silicone breast implants. And we thought we might be able to do something with these too.
Yeah.
Because you said people are also concerned about rupturing these.
Yes.
And you can't rupture them, is that right?
We've had numerous physicians take these implants and try to cut them, and they're worried because they are so soft that would they leak. And I thought, Heather, you had a great idea, as far as running it over with a car and throwing it down. They're very.
But this one, see, the thing that I didn't do, and we haven't done, we're not planning to cut it. Like you can cut a silicone breast implant.
Yeah.
You can cut right through it, and there is sticky stuff in there. It's not solid.
Yeah, this thing's
So
like
we
one
weren't talking
piece.
about cutting it, because we know we can break a silicone implant with a knife.
Yeah.
We know that. But this one, I'm thinking of doing something where I actually can chop it in half, because this, you can even chop it in half and it won't leak. Right?
It's almost
Right.
like a mold.
This isn't like
of
a shell with
Yeah.
material
There's no
inside.
shell, and there's nothing to leak. We go as soft as the FDA allows us to go. And you still get that natural feel and look without the risk of any leakage, really. It's a different Choré. We call them Chorés and durometers in the way we measure the softness of these implants. But that's not a worry. That wouldn't be a worry at all with this. And that is a great advantage to have them, as I said, softer than they used to be. That's one reason why they have gained popularity, as well as it being a super fashion trend at this time.
Oh,
Yeah.
everybody wants the butt.
Now I'm going to ask the question that a lot of patients are probably asking is recovery. How is that considering you're constantly on your butt, whether it be laying down or sitting in your car driving? I mean, how is that going to be comfortable, and when would you usually get comfortable at some point, right?
Basically, they're implanted a lot higher than some people think because you're not really actually sitting on them. And so that addresses one question right there. And the recovery is, it does require a degree of compliance. The patient has to, the first week I'd say is you have to be very compliant. And as long as you listen to the doctor and follow the instructions and just take it easy, for that first week, I'd say after a few weeks to a month, you'll be on your way back to getting back to the swing of things.
Just like with any surgery, with time, everything does get better.
Right.
So you can sit on them.
Yeah, and you're not really actually sitting on them. They're actually implanted a little higher than that. But you do have to, you have to really realize that it's a high tension area and be careful.
You have to be careful.
Right.
You said don't plop down.
Right, exactly.
You said don't plop down.
Listen to your patient coordinator and follow the post-op instructions.
Okay.
And,
but you also have other interesting implants we had talked about before. You have, you showed me an older gentleman who made himself kind of look buff. You put the implant in the bicep and the tricep. You have calf implants. And my husband wants the washboard stomach implant. But do they have that?
Six-pack. Oh, yes. Everything. Anything that you want in regards to soft tissue reconstruction and augmentation, we can make it. We'll do it custom if we don't have it.
So the sky's the limit.